2004, I was diagnosed with Hashimoto's thyroiditis. I was 12 years old. Hashimoto's is a chronic autoimmune disorder. My body produces antibodies that destroy my thyroid tissue. It causes hypothyroidism. I was in for a yearly sports physical when my pediatrician noticed a goiter. He started to ask my mom about any family history of thyroid disorders. My first cousin on my dad's side has Hashimoto's. My pediatrician then asked if I felt cold all the time, if I felt more tired than usual, or if I was having any trouble concentrating in school. It was June, and I was always chilly when in air conditioning, but I thought nothing of it. I thought it was just because we didn't have AC at home, and so I just wasn't used to it. My mom told my doctor that I had to get at least 8 to 9 hours of sleep or I would be cranky. Again, I thought that this was just because I required that much sleep at that age. They were always saying that teenagers needed to get at least 8 hours of sleep, so I never thought anything of it when I would wake up from 9 hours of sleep and still feel tired. I didn't think I was having trouble concentrating in school until after I noticed my concentration increased after starting medication. So my doctor ordered some lab tests and looked at TSH and free T4 and found that my TSH was high and my free T4 was normal, but on the lower end of the range. He started me on a medication called levothyroxine and said that I would need to have another blood draw in 4 to 6 weeks to see if I was responding to the medications. Then he would adjust my dose based on those values. I saw an endocrinologist within the first year of my diagnosis, and I remember him telling me that this condition meant that I just have to take a little pill for the rest of my life. I know that's what he had to say to an adolescent about a new diagnosis with a chronic disease, but as I've gotten older, it turns out that it's not just a little pill to fix a problem. It's a chronic condition, and I have to deal with the symptoms every day for the rest of my life. He told me and my mom that I was at an increased risk of developing Hashimoto's because I was a white female with a family history of the condition. The only unique thing was that I was an adolescent at diagnosis, when older age is more of a risk factor.
Here is a figure that shows the possible pathogenic mechanism of Hashimoto's thyroiditis. Genetically predisposed individuals could be influenced by an environmental trigger, for example, dietary iodine, infection, pregnancy, and cytokine therapy, that induces an autoimmune response against thyroid-specific antigens by infiltrating immune cells. The autoimmune process results in preferential T helper type 1, or Th1, mediated immune response and induction of apoptosis of thyroid cells that leads to hypothyroidism. T4 and T3 levels are initially elevated in subacute, acute, and silent thyroiditis, but become depressed with time. In chronic Hashimoto's thyroiditis, thyroid hormone levels are usually low, TSH level is high. Suppression of radioactive iodine uptake is seen in subacute and silent thyroiditis. Antithyroid antibodies are present in Hashimoto's thyroiditis. Here are a couple graphs that show Kate's TSH and T4 levels through the years. As you can see in this one, Kate's TSH level fluctuates over time. At time of diagnosis, her TSH was elevated above normal, indicating Hashimoto's along with physical symptoms. As you can see in this one, Kate's T4 levels have stayed within the normal range in the same span.
The goal of medication therapy is to get into a euthyroid state where my TSH and free T4 levels are normal and I'm symptom-free. This process of blood draws and medication adjustment has continued. At first, I would get my blood levels checked every 4 to 6 weeks, and if there was no med adjustment, I could come back in 6 months. But if they needed to adjust my meds, I would have to come back in another 4 to 6 weeks. I eventually got to a point where I only needed to be checked every 6 months, and now I only have my levels checked every year. Over the past 12 years, I have reached euthyroid state and my lab values from time to time, but as for the symptoms, I still struggle with a few, such as fatigue, depression, and cold intolerance. It seems like it took a handful of years to get my medication dose to the right dose for me, but I was still struggling with some symptoms of hypothyroidism. This can be due to a lot of different factors, such as sometimes I would forget to take my meds, or I wouldn't take it at the same time every day, or even I would take it with food. Another factor could be that I was taking a generic drug. Last year, I was taking 175 micrograms of levothyroxine daily. I was still struggling with major fatigue and depression. I had a conversation with a pharmacist who told me that levothyroxine, a generic for Synthroid, is made by several different pharmaceutical companies, meaning that the dose of levothyroxine might be just slightly different, even though it's marketed at, let's say, the 175 micrograms. And depending on the month, she may get levothyroxine in from a different company. I never thought anything of it until then, but I had noticed that the color of my pills might change from time to time. When I asked about it, they always said that it was the right dose, just from a different company, and that it shouldn't affect me. She suggested that I ask my doctor about switching to Synthroid, the brand name, and see if that helps my symptoms. Today, I am taking 175 micrograms of Synthroid, and my fatigue has improved along with my depression. The cost of my medication after switching has gone from being completely covered by my insurance to now $33 a month with the same insurance plan. So to save some money while I'm in school, I've been piecing together my dose from samples that my mom gets at her job. So now that one pill a day is several pills.
After hearing some of Kate's story, we've identified 3 priority problems that she faces. The first being physical signs and symptoms of hypothyroidism, especially fatigue. I can only imagine how frustrating it can be to get 8 hours of sleep at night and still wake up feeling tired. As a college student, another big priority problem is cost of medication. After Kate switched to Synthroid, she noticed an improvement of symptoms, but at a cost. Coming up with the money every month for the medication can be a struggle, especially for a busy college student. This leads to the third priority problem. College students are very busy and don't always have a regular routine. It can be easy to forget to take the medication at the same time every day. Since it's a hormone replacement, Kate has to have a daily dose of this medication. It is recommended to be taken at the same time every day to provide her body consistency. This moves us to the 5 patient needs we have identified for Kate. All 5 of Kate's needs are intertwined and affect one another. The first is nutrition. Hypothyroidism slows down metabolism. This can cause signs and symptoms such as constipation and weight gain. Another aspect is increased risk for celiac disease, which is another autoimmune disorder. There is new research that shows association between autoimmune thyroiditis and gluten sensitivity. Kate's doctor has been watching her total protein levels, and based on the below normal values, he is thinking that she is not absorbing the protein in her diet due to a gluten sensitivity and its effect on the intestines. Disturbed sleep pattern was identified by her periods of exhaustion, which were leading to oversleeping. This then leads to not being able to sleep during the night, furthering the exhaustion. Unfortunately, Kate's exhaustion and fatigue then leads to decreased activity level. All this can lead to depression, and it becomes a vicious cycle where not getting enough sleep produces stress, which affects activity levels and eating habits, thus worsening depression symptoms. All of these needs are hard enough to meet as a healthy young college student, but having imbalanced hormones on top of this makes dealing with everyday ailments even more tedious. The main goal for patients with Hashimoto's is to maintain euthyroid state, or healthy hormone levels, with lab values as our way of measuring this goal. Kate's lab values serve as evidence of reaching her euthyroid state. Within the last few years, she has met this goal. However, this does not mean she is symptom-free. Another important goal is to decrease any residual signs and symptoms of hypothyroidism, such as fatigue, depression, and activity intolerance. In order to achieve this goal, Kate has to remain in the euthyroid state. She has gotten closer to achieving this goal after switching to Synthroid.
Nursing care of the patient with thyroiditis includes patient teaching regarding the disease process and course of treatment. Stress the importance of not abruptly discontinuing medications. Instruct the patient to remain under close health care supervision so that progress can be monitored. In addition, teach the patient to report to the healthcare provider any change in symptoms, such as difficulty breathing or swallowing, swelling to the face and extremities, or rapid weight gain or loss. Instruct the patient receiving thyroid hormone about the expected side effects of these drugs and measures to manage them, including symptoms of overmedication such as heart palpitations, excessive sweating, rapid weight loss, heat intolerance, and insomnia. It is important to note that in Kate's case there are no cultural implications. However, some cultures may not rely on hormone therapy. Rather, they may seek a healer or other forms of health remedies. With that, here are a few things that we want you to remember when you're practicing nurses taking care of a patient with Hashimoto's. Our 3 implications. Number 1, patients are not always overweight before treatment. They may very well not even be symptomatic. Number 2, medication noncompliance does happen, just as it happened with Kate. And number 3, Hashimoto's is a complex condition involving metabolism, mental status, and much more.
Looking forward, I know that I will continue to face this disease, but there are many different resources available to help me cope, learn, and understand. As I get older and think to having kids of my own, I will have to have an endocrinologist closely follow my thyroid function through the pregnancy and after the birth. I will have to closely watch my own kids for symptoms of Hashimoto's, being that I can potentially pass on the genetic susceptibility. I will have to carefully monitor for symptoms of other autoimmune diseases. Unfortunately, once you have an autoimmune disorder, you become predisposed to other autoimmune disorders such as celiac, Addison's, and Graves' disease. There are lots of different online support groups on Facebook and social media sites. I follow several different blogs of people sharing their daily journey with Hashimoto's. It's been helpful knowing that my journey is not all that unusual and that I am not the only one struggling with symptoms of hypothyroidism while my thyroid levels are normal. Although this disease is bothersome, in the grand scheme of things, it could be much, much worse.